They ought to have some interest.
Why you're it's just a fresh.
Well, all the other ones we've had have pretty much been kids doing it themselves. The way to fix that would be just tack on an extra day of school
I'm doing it separately.
every year, and then that way their own peers will get it.
I have to retype it. Yeah, someone in it was like, don't never do that to me again. Yeah, so
I just looked
that was
I'll find out for you.
no. Hackers aren't good. Haven't seen you in a few years. It's been a while. How are you?
Save them for last.
Saving the best for last. Starting.
Operation Save Them.
Right.
Cindy Green.
I'll do whatever you want. That's okay. I'll sit here too.
Hey, how are you doing?
I brought a pen for my everyone. Yeah.
Chucky?
Good speech.
Good job. Okay.
You're the only other person.
Thanks for coming up.
Is it your turn? I'm showing up. Good shot.
You can even tear it. The town council's gonna be forming a meeting with the chief.
All right, I'm gonna slide across this.
Give you a little space, we can tackle that.
Hi, good evening, everyone. Thank you guys so much for joining us today. My name is Emily Keller. I'm the Special Secretary of Opioid Response for the Moore-Miller administration. It's an honor and a privilege to be here this evening. So we're going to get a little bit later into more of who I am, what we're doing, what my department is doing, why we're here tonight. But first, I want to kick it off to the Talbot County Health Officer, Dr. Maria McGuire. Thanks so much for joining us.
Thank you. Thank you to everyone for coming tonight, and thank you, Secretary Keller, for joining us and welcoming you to Talbot County to discuss this important topic. So I just wanted to give a few brief remarks about the opioid epidemic in Talbot County and what we're doing about it locally. I want to first point out some important figures whom we are honored to have in attendance tonight. Our County Manager Clay Stamp, thank you for coming. Our County Council President Chuck Callahan.
We're going to support everything we can and help these guys. I can tell you that.
Thank you. So just to give sort of a brief overview of some of the issues we're dealing with now, with the opioid epidemic, we're seeing some interesting changes these past couple years. So I'm sure a lot of you are aware of the increase of fentanyl and synthetics such as xylazine. So that's been really a much different situation for us in addressing the opioid epidemic. And synthetics such as xylazine are much more difficult to deal with. They're very harmful and more prone to overdose and fatal overdose at that. And something that we have seen that in using Maryland's rapid analysis of drugs and the illicit drug supply in Maryland of samples that have been able to be collected and tested, 74% that tested positive for an opioid contained fentanyl and these fentanyl analogs. And among those that, 74% of the samples were positive for an opioid, and of those, 99% contained fentanyl or a fentanyl analog. And among the samples that tested positive for fentanyl analogs, 80% also contain xylazine. So we're dealing with a much more complicated situation in the past few years. We're also seeing what we call like a syndemic of HIV, viral hepatitis, and substance use disorder. So in addition to polysubstance overdose deaths, we have some other chronic illnesses that we're dealing with. And the past few years, of course, we've seen other crises intertwining with the substance use problems, increased mental health needs, and especially during the COVID-19 pandemic, an increase in isolation and vulnerability that's been putting more people at risk and creating barriers to effective treatment. So, and in the context of our substance use disorder problem, we're seeing higher rates of unmet behavioral health needs, including higher and increasing rates of suicide. And we're seeing more children and youth affected by their parental behavioral health conditions that are impacting the child's academic success and increasing their risk of prolonged behavioral health issues. So that really creates a multiplier effect across the generations. So I just wanted to highlight a few of the initiatives that we're working on in Talbot County and at the Talbot County Health Department. So we are trying to bolster the workforce and create pipelines for education and training, especially with our peers that go out and help our clients. We are trying to prioritize data-informed strategies. And fortunately in Maryland, we have a lot of good data with the PDMP, and the OOCC provides us with a lot of very useful data. We're continuing to address stigma and utilizing outreach and advertising and campaigns to promote appropriate and sensitive messaging. And we have robust programming for care coordination and the continuum of care that's needed. We have some partnerships that are really allowing us to be successful in certain areas and really target vulnerable populations. And I just wanted to highlight some of those. We are working closely with our partners at the county level, including our school systems and our local management board, in addressing the youth behavioral health services. And soon we will be implementing the Consortium of Care initiative from the Community Health Resources Commission to really focus on the addressing the needs of the youth and school population and addressing their behavioral health needs. In the health department, we've been putting an increased focus on addressing the special population of the pregnant women by increasing perinatal and postnatal counseling and care management, both to prevent problems and link to services for those women, but also to minimize the effect on the newborns and their families of neonatal abstinence syndrome. Another special population that we have a program with is the inmates at the detention center, and we have a really good and fruitful cooperative agreement with them that involves peer support and case management. But there's some other areas that we're also trying to increase, such as housing supports with recovery houses and increasing harm reduction tools available to prevent bloodborne disease, decreasing risk of infections, and preventing overdose deaths. We also have a very robust program to ensure access to naloxone and try to expand distribution of that important resource through outreach, leave behind programs with public safety entities and correctional facilities, and with our ambulatory treatment providers. So there are some long-term goals that we are focusing on, and those include an increased spotlight needed on upstream prevention, but also downstream prevention. And so we're trying to really focus on how do we address some of these vulnerable populations using a lens of equity and providing more social connectedness and family support, especially for our African American, Indigenous, biracial, and other special populations, and really creating an overall culture of health to improve personal and family health, because those supports are so needed for addressing the opioid use disorder. Some of the downstream prevention efforts that we'd really like to focus on include housing, workforce development, lowering barriers to early treatment, and accessing the full spectrum of treatment including naloxone and other harm reduction strategies. We continually try to address gaps in services and provider shortages and really seek to ensure that our resources are adequate to meet the growing demand. So, and some other long-term goals that we're trying to do are increase the number of primary care providers who are willing to serve patients with low-intensity behavioral health needs, and that would hopefully decrease the gap in the availability of behavioral health needs using resources such as the behavioral health in primary care, BHIP. We're also trying to increase equity across the continuum of behavioral health services, sharing best practices for and addressing cultural values in our community, and extending treatment and social supports to families because the entire family is affected with substance use disorder. So that is a little bit of an overview about the wide variety of programming we have in the county and some of the partnerships we have. And so I wanted to also introduce a key presenter tonight, Talbot County's Sheriff Joe Gamble, known for his leadership, dedication, and professional excellence in Talbot County and the state of Maryland. When he's not keeping the peace, keeping our schools safe, and responding to emergencies, he's making commitments to and supporting the youth and families in our community. Sheriff Gamble has taken an active stance in youth program development, restored the Talbot Teen Court program, and founded the Talbot Goes Purple, which I believe is the first program in the state of its kind. Talbot Goes Purple is an initiative from the Talbot County Sheriff's Office and Tidewater Rotary in partnership with Talbot County Public Schools, St. Peter and Paul School, and the Midshore Community Foundation. And we're really honored to have him up here tonight.
Thank you, Doctor, for that introduction. So I want to talk a little bit about interagency collaboration and kind of law enforcement's role in that, and kind of the traditional role versus the role that we've really expanded into. And before I do that, I want to introduce Chief Alan Lowry, the Easton Police Department. Many of you, he's newer in our, not newer in our community, but newer as the police chief in our community. He's a great partner of the Sheriff's Office and all law enforcement. So like Dr. McGuire said, you know, the Purple program, there's a lot of things that the public doesn't really see. So we've actually started clubs in our schools several years ago. So we have Purple clubs in our schools that are meeting regularly, kids attending, talking about substance abuse. We have contests in our schools, so we're trying to really engage that population. And our hope and our goal is to have that, have those high school students to actually lead the charge in our schools to change the way, the mentality of our schools in regards to substance use. So we're really proud of that. Our teen court program, we take first-time youth offenders, and instead of referring them to Department of Juvenile Services for minor nonviolent, first offense minor nonviolent offenses, we engage them in teen court, which is run by students. The judge is a student, the jury is a student, and the great part about that is we get to send them in that program to be evaluated for substance use issues early. And then we can mandate through that program help, counseling that they might need. So we really are trying to meet between our educational program in the schools and the program is really trying to educate and catch them at an early age. And I was talking to Emily, and Emily and I met 5 years ago when she was the mayor of Hagerstown. And we went up there and presented because Emily had called me and said, hey, we want to do this Purple thing up here. And she kicked it off great. They did a great job out in Washington County. But we were talking to Emily earlier, and what we really need also is, and I'm so glad that she's in her position, because, you know, some juvenile reform laws have passed recently. But what it really does, it doesn't, like juvenile services is called juvenile services. So anybody under 13 now is not getting services. So we've engaged with our legislatures, we're engaging with the governor's office to try to change that so we can get those kids services at those early ages, because the sheriff's office, we're really trying to push, especially with other SROs and our other programs, intervention early, education early. And one of the other things that I don't see coming out of the federal government is a lot of grants for programs like ours to help finance it, to help finance get the message out. So, we've been talking to stakeholders to try to figure out how we can keep these things going long term in our community. Talbot Goes Purple also started something called Operation Save a Life. Kelly Callahan, who's sitting over there behind Grace Street, is the brains behind Talbot Goes Purple. She just calls me and says, "This is what I want to do," and I nod my head. But it's a box so you put on the wall your business or your country club or wherever you go, and it has Narcan in it. So somebody at your business doesn't even need a key. You just flip the box down so you have Narcan ready. We come and train. We'll come and train their staff. So we can have those Operations Save a Life, and we have them all throughout Talbot County. But we encourage anybody that wants one in their business to reach out to us. We'd be happy to do that. The other thing, we're meeting next week. Brian LeCates, our fine director of Department of Emergency Services, he's a great partner of the Sheriff's Office and all law enforcement in the county. Meeting next week. We have this thing called a safe station. I know many of you know what safe stations are, but not all of you do. So a safe station was enacted in Talbot County by the Talbot County Council pre-pandemic, maybe 6 years ago, I'm guessing. 2018. And that's where somebody who's addicted and really struggling can go. Anne Arundel County started it. The fire departments, they initiated their fire departments because they have 24/7 paid fire in much of Anne Arundel County, where somebody who's addicted or struggling can go and say, "I need help." And then there's phone calls made, peer support comes out, helps them to navigate the system and get them going into a path to hopefully recovery. And our safe stations kind of dropped off since the pandemic. We had good numbers pre-pandemic, 22, 23, 24 type people coming in there yearly to say, "Hey, I need help," and it's pretty much just died. So we're looking at that to revamp that, try to get some energy behind it and some funding behind it to really advertise it and make the public aware, so when you are in distress, there's a place in Talbot County that you can go full time. So anyway, all that said, the role of law enforcement has changed totally with this. 9 years ago, if I sat here, I would not know what to say because I didn't know what a peer was. I didn't know how somebody got help. I didn't know any of that. And I think that's kind of true for most law enforcement. So the partners we have in the room here today have educated me. It started with day one with Valerie Albee, and we have so many great things going on in Talbot County. She walked in my office the first day I took office and said, "You ran on this, and I'm here to tell you, you need to do something." But Val fulfills a valuable mission in our community. She has Mariah's mission. She lost her daughter and to this horrible disease. And she has a place where people in recovery can come get free, nice clothes. And her husband fixes up bicycles for people at the recovery houses for transportation. And Kelly Callahan over there, my purple lady, got a grant, applied for a grant. She's just a citizen, right? Had a small business, nothing related, somewhat related to this, but applied for a grant, got a grant, and she's filling a niche. She's got peers over there. She's got stuff going on. So what's happening in our community, it's good. It's getting better. We need more. But it's people like this in our community that is really going to help us change the tide. And for law enforcement to be able to connect with them, understand what's going on, understand what their missions are, and then try to push that information out to the public, I think is really important. I think that's our role as law enforcement, is to do that and engage people. I was just looking at I get a weekly sad email every week on all the law enforcement agencies on the Eastern Shore and how many people have overdosed, fatally, non-fatally. And it's got pictures and there's stories in there. So every week I'm reminded, and I can actually see their faces, of those people on the shore that are dying or suffering. And almost every single one is a repeat offender. I'm not saying he's a repeat crime offender, but a repeat overdose offender. And then you can track them. and then see like 6, 7 times, and then they die. And we have to do a better job trying to engage them and get the peers and the support that they so desperately need. Turn it back over to you, Emily.
Thank you. Thank you. Thank you both so much for being here and for all that information and for what you guys do every day. This is not an easy field to be in, so you're appreciated. Again, my name's Emily Keller, Special Secretary of Opioid Response, and I have the honor and privilege to oversee the Opioid Operational Command Center. So a little bit about how I got here, how this came about. I am formerly a city council member for the city of Hagerstown from 2016 to 2020. In 2020, I became the mayor of the city of Hagerstown. I actually ran for office, which I never imagined in my life. If you would have told me 10 years ago I was going to run for office, I would have said, absolutely not, you're crazy. I don't want to be a politician. It's not something that interests me. But my best friend, Ashley, struggled with a substance use disorder, and I watched her struggle for years and years and years. So 2012, 13, 14, 15, it was just this vicious cycle. Heroin took over every portion of her life. And I watched what I felt like was our system fail her over and over and over. And in Washington County, especially back then, there weren't really a lot of resources available. And when the time would come and she would say, all right, I'm ready to get treatment, open beds were weeks away. And so it just became a vicious cycle. She would violate probation. She'd do 90 days in jail for violation of probation. She'd get out. She'd violate probation. She'd do 90 days in jail. She wasn't hurting anyone. She wasn't a criminal. She was being charged with personal possession, drugs and things like that. So I figured, I'm sitting here, I'm complaining, I'm calling up elected officials, I'm like stomping, and instead of sitting on the sidelines, maybe I can do something about it. So someone convinced me, they said, you should run for office. I'm like, okay. So in January of 2016, she was actually serving a violation of probation in Harford County Jail, and she called me, and I said, hey, I think I'm going to run for Hagerstown City Council. And she laughed and was like, no way. No way. You're covered in tattoos. You have no filter. What you think comes directly out of your mouth. Like, you're not politician material. And I was like, well, I agree with you, but I'm also loud. And maybe that's what we need right now, because you need a voice. And there's plenty of other Ashleys out there that need a voice. So that's what I did. I went, I knocked on doors, I talked to the people, the citizens of Hagerstown. Thankfully, I made it through the primary. And 2.5 months later, as I was about halfway through my first campaign, Ashley died from an overdose, June 27th of 2016. So what was the absolute worst day of my life, and still is, became the inspiration, because I made her a promise that I would be loud for her and I would be bold. And that's exactly what I have tried to do. So thankfully, or not, I guess, it resonated with the citizens of Hagerstown. I wish it didn't resonate, because that means we're all affected, right? But I got to work, met with your sheriff here, and helped launch Washington Goes Purple. I was actually joking with him earlier, because when Congress went purple, a congressman was on national news, and he said, I just want to give a shout out to the mayor of Hagerstown who started this movement. And I was like, oh. I didn't start it, it was him, but I took the credit, thanks, I guess. But, I just kept immersing in this world and saying we need more solutions. And I worked with the OOCC prior, I worked with our health departments, joined the board of the Phoenix Foundation, helped open the first recovery high school in Maryland. And then thankfully, when Governor Moore got elected in November, he called me in January and said, I think we need this to be a cabinet level position, because we know that while we've made great strides in Maryland, great strides, there's still a lot of work to be done. So it is truly an honor and a privilege that I get to serve in this role. I have an incredible team. So for those of you who aren't familiar with the OOCC, or the Opioid Operational Command Center, we work with all 24 local jurisdictions and all of the state agencies across the state to coordinate the state's response to overdose. 2 of my team members are here today. I just want to shout them out, Deborah and Cassie. Thank you, guys. We are a small but mighty team. There's 10 of us, and we are right now working on doing a strategic plan for the state. So I said, all right, well, if we have to coordinate all 24 jurisdictions, and we have to go to all 24 jurisdictions, we want to hear from every part of the state. So this is number 19 out of 24. It's been incredible, and we've just been coming out and listening to you guys to hear what's working in your counties, what's not, where the gaps are, what I can do better in this role, and what you need from the state. So I'm going to open it up. No one signed up to speak. You guys are a shy. Oh, you have one. Okay. All right. We have one, but more of you are going to speak, I know. Before I open it up, I just want to very, very quickly, high level, go over the 5 areas that this administration is going to focus on, at least right now, as we develop the strategic plan. We'd be here all night if I actually went into detail. Just for high level purposes, our first priority is going to be prevention, which we've heard a lot about tonight. We want to address trauma and adverse childhood experiences and promote school-based and after-school youth programs. Our second priority is going to be harm reduction, because we know we need to meet people where they are at. So we want to make sure that we have universal access to naloxone. Or Narcan, as most people know it. We want every Marylander to carry it. So if you do not have it, we have some fine folks in the back who will train you, and you can leave here with it. It is our biggest life-saving tool. Even if you think you don't know anyone who uses drugs, you never know when you're going to experience an overdose. You could be at a restaurant, you could be at a grocery store. So if you have naloxone, you would be able to save a life. We also want to expand access to wound care, syringe services, and drug checking initiatives, like the rapid analysis of drugs that the doctor spoke about earlier. Our third priority is going to be treatment. We need to make sure when someone says, I'm ready to get help, that there's some place that they can go. But we also want to make sure that means promoting equitable access to treatment through transportation services and telemedicine, increasing access to medications for opioid use disorders, and promoting care coordination. Our fourth is recovery, because we know recovery doesn't last for 28 days. You don't just go into treatment for 28 days and bam, you're better. Recovery is a lifelong cycle. So we want to make sure that Maryland is providing the tools necessary for everyone to thrive. Promoting employment and recovery-ready workplaces, increasing compensation for peer support specialists, because we have some really good peers in the state, and we need to make sure that we're keeping them. And our last priority is absolutely going to be public safety, because we know that public safety officials are often the first to come in contact with people who use drugs, people who are overdosing, or people that are in crisis. So we need to make sure 2 things. One, that our public safety officials have what they need, the tools that they need to help save lives, but also the tools that they need to take care of themselves, because compassion fatigue is real, and they have a very difficult job and a very difficult environment in which to do it in. But we also want to make sure that for people who do use drugs, we're providing alternatives to arrest, because we know we can't arrest our way out of this problem either. So promoting programs like LEAD, or law enforcement assisted diversion, which takes low-level offenders and provides them treatment options instead of jail. We also want to make sure we're providing medications for opioid use disorder in detention centers, and expanding reentry planning services and care coordination upon release. So those are our 5 priority areas, and a very high-level overview of what falls under each of that category. And we just want to hear all the feedback that we can get. So we have one person who signed up to speak today, but I know more of you are going to. So Cassie's going to bring a microphone around. I asked you try to limit your remarks to just a couple minutes. I'm not going to buzz you out, but just to give everyone who wants an opportunity to speak the opportunity.
Is it Bree? Bree. Okay.
Bree?
Oh my God.
Hi, I'm Brianna. I am a peer recovery coach at Grace Street, the first RCO in the Mid-Shore area, and I'm very, proud of what I do. I wasn't thinking I was going first tonight, but something that I wanted to bring up that's a personal passion of mine, and a gap in services, as you've mentioned, is something that I look at as like bereavement of AMA. Like when there's a behavioral discharge from a treatment center or a sober living place, and there's someone that wasn't necessarily headed towards relapse, but ends up there out of lack of services. And that's just something that I'm looking to fill the gap in. Thank you.
Thank you.
Bree, can you tell us what that first acronym means? You said you're the first ROCK, rock.
I apologize. We are a recovery community organization in Easton, Maryland that services the Midshore area. And AMA is against medical advice.
Anytime I go to these meetings, I need to, because the cops got a whole different line of those. Thank you.
Thank you.
That was all that signed up to speak today, but who else would like to speak? Come on. Yes, sir. She'll bring the mic over to you.
I'm sorry. I'm sorry, Terry. I didn't even see you sitting there. Terry Kokolas is the director of our detention center here in Talbot County. He's been a great partner of ours. I apologize. I didn't even see you sitting behind the chief. He was covering you up. But,
Stronger set of glasses.
As Joe said, I'm Terry Kokolas. I'm Director of Corrections here in the county. And I've been involved in addictions with an incarcerated population since the early 1980s. In 2000 and teens, there was recognition in Annapolis that there was an addiction problem. And by the way, most of the individuals that are incarcerated are positive for addictive materials, alcohol or substance abuse. You, as the new director of the OOCC, probably the fourth, I guess, in line of succession. And as a director of corrections, I am mandated to provide services, which is a great idea, but those services are extremely expensive. They are mandated by a House bill that came out of the legislature, which was a great idea, but it had no follow-up, it had no follow-through, and it had no conclusion. So the funding ends June 30th of 2024, and jails are continue to be mandated to provide addiction services, which is great because we're the #1 addiction and detox facility in most counties, myself and my 23 colleagues, including Washington County, and we provide the services as best that we can. They're expensive. They're very expensive. And in Talbot County, because there's no continuity of available services in the state of Maryland, I cobbled together between the University of Maryland, the health department, and a number of other entities to provide the services. So I get some from a privatized medical service, some from medical prescription services through the University of Maryland. I pay for the medications. Some I'm reimbursed through the OOCC. But the OOCC is a very, very difficult process for reimbursement because in the attempt to lay out House Bill 116 to mandate services in jail, there's no follow-up on how a jail could even request reimbursement. So it's become a labor-intensive process to request, and I work with Khalil and with Deborah, so I understand they do everything that they can, but we have staff that provide services to the inmates for the medically assisted treatment part. We have dollars for the medication. We don't have dollars for staffing on a jail administrative side to be able to lay out the process in a good way. And the funding ends next June. So I'd like to find out what the vision is of the OOCC and what the governor, who has prioritized it to a cabinet level position, might be going forward.
So when you announced your title, if I were a betting woman, I would have won that bet because I figured you were going to discuss funding for House Bill 116. It is a very, it's a topic of conversation all across the state. In fact, one of your colleagues asked me for my address so he could send me the bill. So, but
I won't go that far.
But this is a topic of conversation for sure. As we look at the opioid restitution fund money, my team, prior to me being there, put those grants out through a settlement that came directly through us that we had all of the decision-making ability over. Now the Secretary of Health is overseeing a lot of those dollars. We have been in constant communication with GOCAP because they were actually the team that was supposed to take the lead on this. So it's been some back and forth. We've had conversations with legislators. So the simple answer is I don't have an answer as to where the funding is going to come from, but it is for sure a priority. And we've seen, and I hope that you have seen, great results from providing medications for opioid use disorder, especially when it comes to overdose deaths and overdose upon release, and recidivism rates, which we've been hearing across the state have decreased for people with substance use disorder. So that's what we want to have happen. We know that it needs funding. We know it's expensive. We know it's labor intensive. My team did go out to Washington County and actually watched their process, and that process of having 5 people in a room for 20 minutes and then having to get them back, and it's a lot. So we know there needs to be follow-up funding. The state was supposed to provide funding, but that has not been decided where that's coming from yet. So I don't know the answer. There will be an answer. Yeah, there will be an answer though, because this has to stay funded. There's no way we can backpedal now. So sorry, I know that's probably not the answer that you want, but it's just the truth right now.
Well, I wanted to put you on the record.
No problem. Who else would like to speak this evening?
Good evening, all. My name is Leon Tillman. I'm just a concerned citizen. I didn't hear anyone speak about Vivitrol or naltrexone or. Is that still being used or marketed in a sense?
It is.
You don't hear it very often noted, though.
There's been an increase in the medications that are available to treat substance use disorder and opioid use disorder, but Vivitrol is something that is still being used. It's just significantly more expensive than some of the other options.
Thank you.
You're welcome. You guys can't let me off that easy. Yes. She'll bring the mic to you.
I'm Mike Flaherty. I live on Tillman Island, and I've spent most of my life addressing opiates and overdose and recovery. In my work, what I've learned is that the solution, or if there is, we're losing this battle. We're not winning it, and it's getting worse every year. We're moving step by step closer to legalization in this country. We need a strong prevention plan. We need a demand reduction and a supply reduction at the same time in communities. The real solution method, though, is to come from a community up, not a system down. And what we're doing in our country is we're providing methods to reduce, but not to solve. And the solving is when each community unites together, sort of as we kind of did in Tillman, with the help of the sheriff, with Narcan and peers, and just moved it on out as much as we could. But in other communities, but if a community comes together and says, not here, and you put your community leaders, your peers, together with your physicians and your legislators and your policymakers, you can direct the kinds of services that are needed for each community to address where it is most needed, not where the book or the textbook says go. And that's what I would suggest. We have a community-wide effort that comes up, builds on recovery, and unites all the strengths we have in this county, at least, if not joining counties too. Thank you.
Thank you.
Michael is just a force to be reckoned with on Tillman. He's started so many programs out there for that very reason. He has a community that is a close-knit community. I think it's the closest knit community in all of Talbot County. It's still truly a community. People know their neighbors and love their neighbors. Sometimes they don't love their neighbors, but it's truly a community, and he's done great things down there and a tremendous amount of work. So I give you credit, Michael, for all the work you've done down there and the faith community that you've partnered with and everybody else. He's done good work, and we've seen great improvement there.
We're trying to get the churches as safety nets and expand it through the county as such. Thank you.
Thank you. I couldn't agree more that community is where it's at, and the community-based organizations that we have all across the state do really, really great work. It would be nice to see everyone come together even more. But like any system, a lot of us operate in silos, and that's just not in the substance use world. It's in pretty much any world you get in. So I'd love to break down those barriers.
Hello, my name is James Carter. I am a peer support specialist. I hear all the initiatives and everything that's going on, but I still didn't hear anything about the mental health piece. You know, a lot of them are dual diagnoses, and you know, as far as the recidivism rate, yeah, I see there's a lot of different programs that's in place, and for some reason they're all different. Why can't they? Why can't they have something similar to this? Come together, come up with a plan that works for everyone. Because I know for me, I was one that was incarcerated and went through all of these things. I had to help navigate my own self and figure out resources and stuff that was out here. But I also have mental health issues as well. And that also can be a part of people continuously to relapse and have all that stuff because for some reason here on the Eastern Shore, they don't have enough psychiatrists and therapists. You know, and a lot of it, you know, because of COVID, they're doing the Zoom thing and they're getting on there, but in reality, they want someone to be physically there. I know for me, I would want someone physically there that I can actually talk to and be able to connect with. You know, I'm so proud and great that peer support is there to fill that gap, but still in all, we still need other providers to be able to help us through these things and help the challenges that we have to deal with peers that's going through a whole lot more than just the addiction. That's only 10% of what they're going through. And then they have to deal with their self. You know, how do we do that?
Well, first of all, thank you for what you do. I think peers are going to be our way out of this, for sure. And I think we've learned that a lot over the last couple years. For the mental health piece, in my office specifically addresses overdose issues, but I agree with you, almost everyone with a substance use disorder normally has a co-occurring either mental health issue or other issues. So part of what we do as we write the strategic plan is to work with other departments within the state of Maryland that address things like mental health. So we work directly with the Behavioral Health Administration that oversees a lot of the mental health programs. They just got a new deputy secretary who's coming to meet with our team in about 2 weeks, and that's part of the conversation we're going to have. So it's up to us to help coordinate those different services, because while we oversee specifically overdose, we have to work with all of the other partners that also deal with mental health. So that is something that is a huge priority. I didn't address it just because I was speaking more just specifically toward overdose issues, but as far as co-occurring, that is something that we plan on working directly with the Behavioral Health Administration, the folks that are doing that work specifically.
Should be one.
I agree. Yeah. Or at least two separate working very, very closely together, which is what we hope to do.
And I could say, I was able to meet with Alyssa Lord just last week, and she has repeatedly said one of her top priorities is the integration of the behavioral health and the substance use, because, I mean, quite frankly, that's how it happens in real life. You know, it's yourself, it's your brain. And so I totally can't agree with you more about the need for the comprehensive nature of the approach from, you know, including psychiatrists, therapists, the medication-assisted treatment, and all the supports, housing, workforce, that kind of thing, because that's what's really needed. You can't go by it piecemeal. So I really hope, and I'm really looking forward to seeing BHA and OSCC working together on these initiatives.
Yeah, she's great. Yeah, we're looking forward to it as well.
There's some people in this room that have had long conversations with me about gaps in the system. Now's their time to speak.
Is there a plan in the new hospital for behavioral health services? Number of beds, withdrawal management, women who are pregnant? Do we know what the new hospital is going to include?
I do not. I know that I don't want to speak for the hospital board, but I had a meeting with the hospital board, and I know that there's some funding that needs to be met before there will be matching funding from the state with the change in the governor. The previous governor had committed some funding, and there needs to be, with the new governor, there needs to be some match money up front. So Clay probably would know better than I would, or the county council would probably know better than I would, but I think we're still years away.
Yes.
No, the only thing I would say is there's a lot of energy right now with the interest in building the new hospital, and this issue needs to be front and center. And I think that's a takeaway here. They're trying to get their CON approval to move forward with the new hospital. It's going to take a lot of effort at the community level, state level, but this issue needs to make sure it's front and center. So that's all.
Thank you. Anyone else this week?
I work at the hospital and being.
She's gonna bring you a mic, that way the live stream can hear you.
Yeah. So, I just wanted to tell you that I've seen the plans for the behavioral health section of the hospital for inpatient and outpatient. You need staff, of course. They're trying to put in medication management, outpatient and inpatient for co-occurring. So outpatient for both substance abuse as well as mental health. So yeah, there is a spot allotted for that. For both of that. There's a big poster hanging on my wall of where we're going to be and all that. But yeah, they didn't forget that. So
Thank you. All right, if there's no one else that would like to speak, we have a couple minutes to spare, so we'll be walking around chatting with everyone. But I do really want to thank you for your time, for talking to us, for showing up tonight. I think with COVID kind of overshadowed this crisis that we're in. COVID got a lot of attention, obviously rightfully so. But I think that in some communities and some people who don't live in this world, they thought maybe it went away or got a lot better, and it didn't. So for you guys taking time out to come listen and to provide input for us is really important to us. I'm looking forward to working with all of you guys. I know this is a really heavy subject, and for those of you who work in this field every day, it's exhausting because you have to see the worst of the worst, but you also get to see the success stories and how incredible the hard work that you guys do pays off when we save lives every day. So thank you. And what I can definitely say without a shadow of a doubt is from being in this position for the last 10 months and traveling the state, I've gotten to meet really, really good people who are working really, really hard to combat this overdose crisis and to make sure that we're saving lives and that there are less stories of us losing our loved ones and our family members. So for the work that you guys do, thank you. I'm looking forward to working with you, and you can contact our team anytime at beforeitstoolate.maryland.gov. My email address is just my name, emily.keller@maryland.gov. And thank you again for your time, and look forward to working with you guys. Drive safe tonight.
So you work closely with
Okay. So do I.
Might not have been a
You're on that. I'll show you.